Good day, everyone. Good day, classmates and Doc Mel. So here is my report for the Module 8, and my topic is all about the challenges in monitoring and evaluation M&E of Advocacy, Communication, and Social Mobilization, or ACSM programs. So, monitoring and evaluation, or M&E, are essential components in the effective implementation of development program, including advocacy, communication, and social mobilization, or ACSM. ACSM programs aim to promote behavior change, foster community participation, and influence policies to support development objectives, particularly in the health sector. So examples are campaigns for tuberculosis awareness, HIV prevention, immunization drives, and community sanitation. However, monitoring and evaluation of ACSM interventions present unique challenges due to their inherently complex, qualitative, and often long-term nature. That is according to the World Health Organization last 2007. So, let us have the challenges in monitoring and evaluation of ACSM programs. So the first one will be the intangible and long-term outcomes. So ACSM programs primarily aim to change attitudes, behaviors, and social norms, objectives that are inherently difficult to quantify. So unlike clinical or infrastructural projects that yield measurable outputs such as numbers of vaccines administered or latrines built, ACSM outcomes such as increased awareness or attitude change are less visible and take longer to materialize. That is according to NACBIN 2000. So this makes it challenging to track progress and determine effectiveness within a typical project cycle. So for number 2 is attribution and causality issues. So establishing a causal link between ACSM activities and observed outcomes is another key difficulty. So for instance, if a community shows improved health-seeking behavior, it may not solely result from an ACSM intervention, but from a combination of factors such as improved access to services, policy changes, or socioeconomic developments. So as a result, attributing changes specifically to ACSM becomes methodologically problematic. Number 3 is the lack of standardized indicators. Unlike biomedical programs with well-established performance metrics, ACSM lacks universally agreed upon indicators to measure success. So many ACSM indicators are qualitative, for example, the improved perception or community empowerment. And while useful, they are often subjective and harder to compare across programs. That is according to UNICEF 2005. So the absence of a standardized set of indicators complicates data collection, analysis, and of course, reporting. For number 4, we have inadequate data collection tools and methodologies. So traditional M&E tools are not always suitable for capturing the nuanced effect of ACSM efforts. So qualitative surveys may fail to reveal the underlying social dynamics or cultural shifts induced by communication campaigns. Additionally, methods such as focus group discussions and participatory rural appraisals, while insightful, are time-consuming and require skilled facilitators. And that is according to BESET 2004. So digital tracking tools for media engagement also remain underutilized in low-resource setting. For number 5, we have limited M&E capacity. So human resource limitations often hinder the effective evaluation of ACSM initiatives. In many cases, program staff, including field workers and communication specialists, are not adequately trained in designing or conducting M&E activities. So this leads to weak evaluation frameworks, inconsistent data quality, and poor integration of findings into decision making. For number 6, we have resource constraints. So funding for M&E is typically minimal compared to program implementation. As a result, comprehensive baseline studies, ongoing data collection, and impact assessments are often not conducted thoroughly. So moreover, when budget cuts occur, M&E is usually among the first components to be reduced or removed. And that is according to Chaplow and Cousins, 2016. For number 7, we have challenges in capturing qualitative insights. So ACSM relies heavily on understanding local context, community beliefs, and informal communication networks. So these aspects are best captured through qualitative methods such as storytelling, interviews, and ethnographic studies. However, such methods are not only time and labor intensive but also often undervalued by decision makers who prefer quantitative data, of course, and that is according to Patton 2008. The last one, or number 8, will be the data utilization gaps. So even when data is collected, it is not always used effectively to guide program improvements. In some cases, M&E reports are treated as bureaucratic requirements rather than learning tools. So the disconnect between data collection and its application in strategic decision making limits the potential impact of M&E. So while ACSM programs play a crucial role in shaping public health outcomes and community empowerment, the challenges of monitoring and evaluation of these programs are significant. So the intangible nature of ACSM objectives, methodological complexities, resource limitations, and capacity gaps all contribute to these difficulties. So to improve M&E and ACSM, stakeholders must invest in building capacity, developing tailored indicators, promoting participatory methods, and ensuring data is translated into actionable insights. So by doing so, M&E can become a transformative tool for ensuring the effectiveness and sustainability of ACSM initiatives. So here is my personal observation when it comes to that matter. So as a public school teacher, I've often been involved in implementing advocacy and communication programs, whether it is promoting proper hand washing, leading anti-smoking campaigns, or organizing school-wide efforts for environmental awareness, tree planting activities, for example. So while these initiatives are impactful, I find it challenging to monitor and evaluate their effectiveness in a structured way. Most of the time, we rely on simple tools like attendance sheets or post-activity reflections, but it's difficult to measure whether the student's attitude or behavior have genuinely changed. So with limited training in M&E and so many teaching activities or duties already on our plate, we sometimes feel underprepared or unprepared to assess the deeper impact of these programs. So I believe that if we were given accessible tools and proper support, we could better understand what works and improve how we engage students in the wider community. So that will be all, and thank you very much for listening.